our guest who's going to join us from near Tampa. He was just telling us he's in his car. Gary could be anywhere in Florida, you know.
Man on the road.
He is a man on the road, but a perfect guest for today too. Gary, welcome. And listen, just as a means of introduction, and let's start COVID wise. Listen, we're so lucky to have Gary in the green room today because, you know, Gary, by all things, and you introduce yourself from the CDC side, Gary, and your master's of public health, of course. But, you know, all things COVID knowledge. And let's just start with boosters, Gary, and stuff like that, and just kind of segue into it.
Okay, well, as far as boosters are concerned, there's a couple of different factors that are involved. First off, from the Israeli data and from the data coming from the United States, we see that the antibodies do start to drop off at 6 months. We're talking about half-life here, so there's a long, slow digression. And so the question is, when do you need the booster shot, if at all? And if you have a stronger immune system, do the antibodies hang on longer with the vaccine? And so that's a possibility. The other factor is the fact that we have a lot of people across the world who have not had access to this vaccine yet. Africa as a continent is only about 3% vaccinated. And so if we're using that in the United States, and there's a finite amount of vaccine out there, we're usurping it for boosters when those guys haven't got their first or second shot yet.
Is there a finite amount of vaccine, Gary? Is it a supply issue, or is it an issue of certain countries not being able to afford to buy it? I know, of course, everything's been free, you know, here. Well, what goes on in other countries? How do they actually access, you know, the vaccine? Because I agree with you, it would make no sense to utilize vaccine that could be utilized, you know, better in different venues, you know, to stop the spread of the, you know, mutating of the virus. I mean, that's what it's all about. Listen, you're the public, you know, health scientist. You know, Gary actually was in the swamp of the DOH, right, Gary? The pre-Rick Scott days. And, you know, you tell the story. You know what it was like in the days when it was properly funded, properly supported. And then you got washed out when Rick Scott came in. And, you know, I mean, let's face it, there was a much less emphasis on public health.
Oh, absolutely. I mean, ever since Scott came in his first week of office, he decided that government was too big. And so therefore, one of the first things he would reduce was the Department of Health in the state of Florida and get rid of almost all direct service, giving it to the federally funded family health centers. And that really diminished the amount of care that was available out there, because even the the family health centers still cost some money that is not refunded necessarily by the state. And so therefore, a lot of costs went up, and a lot of people did not actually got less access at that point in time. And he let go of almost 2,000 employees of the Department of Health right away, some of which were
he made his money through HCA. He's good.
Well, no, I mean, Ruta comes out of the insurance side of the biz.
Yeah, I'm not a fan of Rick Scott, actually, so I have to say.
Right.
I think he took his money and ran.
And I'm sure that you've been stunned, as we all have, at the disregard for the public health of our kids and our citizens by what our leadership is showing, you know, today. And I know, of course, you're all for vaccines and masking and every public health
funds when the Medicaid funds were available. I mean, the things that they've done to the state is horrible from a public health perspective. Sorry, I digress.
No, I mean, that's where I wanted to start with, Gary. Listen, Gary, there's 3 C's today. It's COVID, it's consumption lounges, which we'll get to. And then I want to just touch on the cannabinoids for a bit and segue into next week's green room, because I know I sent you something earlier in the week that was as much of a shock to you as it was to me, and I don't want to tease the audience too much on it. But, you know, just on the COVID side, once again, do you think that we're headed for another peak at some point, Gary, or do you think that we've gotten to a certain, you know, sense of herd immunity now with the people that are vaccinated and the people that have had it? Or do you think there'll be a mu and a lambda? You know, I don't think there's too many people that can speak to this better than you.
Well, there is a mu and there is a lambda, and then you got Xi, Mi, Omicron, Pi, Rho, you know.
Nice. Yeah, all the Greek letters. Yeah.
Yeah,
what a nightmare.
We know our alphabet from college. It's just from being the fraternity system, and that's when it gets scary, when you realize you're getting towards the end of that alphabet. And we will get there fairly soon, because the more exposure there is of this virus to the general public, the more chances there is of variation, because as you know, the virus procreates by using the the genetic makeup of the host, and therefore, every time it changes just a little bit, which is one of the reasons we could never get our handle on an HIV vaccine for so many years. And I was working on HIV when it first started out. I was working with the Centers for Disease Control, basically tracking that monster. And at a time when we only had AZT, it was still essentially, even with treatment, a death sentence. And we weren't certain if it was going to spread to the point where so many people were getting it so fast that it would actually start to decrease. That never happened because it always had a chance to to mutate to a form which was different again and made it harder for us to track and things of that sort. And that is what the COVID virus is doing as well, because it's also a retrovirus. It also uses the RNA. And so therefore it does mutate. And that's what we're dealing with right now in regards to Delta. That's why we're having that huge peak right now. Now, Delta itself has a two-edged sword. Again, it is so infectious and it affects so many people so fast. At times it burns the clusters of epidemiology out, where everybody in a small area will get it right away. So therefore there'll be less people to pass it on to the next people. And that is one of the reasons why we haven't seen as much Ebola as we could, because it kills people around its area so fast that it doesn't have a chance to spread. Unfortunately, Ebola, of course, is 60% fatal. And you don't even want to go even within 100 feet of it, 100 miles of it.
And that's the interesting thing about this virus, Gary, is that it's what I like to call a soft kill, so to speak. And, I liken it to a game of Russian roulette, in that you really don't know, excuse me, once it lands on you, whether, and when it lands on you, believe me when I tell you, it's got a chance of taking you. And it's interesting to me in that what you were describing is science, the science of a virus. What viruses have always done, they mutate. Somehow, some way, what comes out of the idiot box, okay, in the pocket, which is the cell phone, okay, have certain people believing that it's actually some type of conspiracy theory that the virus is actually doing what it's doing in spite of all efforts meant to clamp it down. And it's so infuriating as a doctor to know that science and the belief in your family doctor and the belief in the miracle of the vaccine and has been taken over by complete misinformation. And a lot of it that we're learning is paid for misinformation by those that want to hurt us as a country.
Which is
So,
sad,
but it's
very
killing
disheartening.
people now.
It is killing people.
And the
But
healthcare
the
environment.
thing that gets me always is, and I've had posts on, Facebook from friends who have had spouses dying recently. In the last week, I've actually had 2 friends die from COVID. They chose not, for whatever reason, they were not vaccinated. And it's funny because it's not funny, it's sad because here they are not trusting the science of the vaccine, yet as soon as they couldn't breathe, they go and trust the doctors. And once they're on the ventilators, they're praying, that these people help them. So it's
bizarre.
It's bizarre. I just don't understand the logic. When they're in desperate need, they go to the professionals. Yet before then, they think they're somehow above that, and it's just ridiculous.
What do you think of the Regeneron tents, Gary? And I haven't had a chance to ask you this throughout the entire, pandemic. Don't you think it's bizarre that people who don't trust in the vaccine necessarily, when they get sick, will go into a tent to receive a monoclonal antibody treatment that, listen, I'm not saying it's dangerous or it's not, but it's surely unresearched to the extent of long-term effects. And who follows these people when they leave the tent, right? Are they going to get any kind of testing in a year or so to see what immunity, what antibodies they have? I think one of the really big holes in the whole pandemic right now is the fact that it's very hard to know what antibody levels people have that say they've had the virus, right?
Well, like even in my case,
and you have, of course, I know,
had
and the vaccine.
I had a very severe case of COVID almost a year ago, and they said that at that time when I was in the hospital, the experts in infectious disease, they had said they thought it was going to last around 6 months for immunity. So, I mean, I gave my plasma, I did everything, but they said after 6 months, all bets are off. They just didn't know. So then I got the vaccine, and now I'm nervous too. It's like, what about the booster? Should you get it? Should you not get it? Is it going to be a benefit? Do I have natural immunity somewhat still in my body? So there's so many questions because I think there's so many unknowns to people that, you know,
It's a novel virus.
virus. And I mean, I think all of us in the office are like, oh, wow. And I've had friends who've had double vaccines, who've had Moderna, they had the vaccines and they got COVID now. So, you know, it's
But unless they're symptomatic,
lesser symptomatic.
not gonna die.
Actually,
thank
one,
God.
no,
know.
one of my girlfriends, she actually had, it was interesting. In her household, it was her father, herself, her husband, and her small child. They all got COVID. And they were all vaccinated except for obviously the baby, but she had a very severe case. I mean, to the point where she was like on the verge of going to the hospital. I mean, very, very sick. And she was vaccinated. But the rest of her family had mild symptoms, cold-like, but she took a heavy hit with COVID.
Nasty virus. That's for sure.
That's why it's like so many unknowns. And I think that's what frightens people so much.
Indeed.
And
it, you know, politically, Gary, it's interesting, you know, Governor DeSantis is playing a certain hand and, you know, it's harming, you know, citizens of Florida, appealing to a base of people that, you know, to me aren't following the science that they should. Yeah, but, you know, we're allowed to get political in the green room. You know, when we have the right guest.
Yeah, but one thing that should never be politicized, of course, is healthcare.
yeah.
And especially when it comes to this. I mean, and when it comes to epidemiology and public health, never, ever, ever should be politicized because there should not be two sides to this coin. That is the bottom line. That is the reason why when we first started out with the AIDS epidemic, they gave them a small room in the basement of the CDC over in Atlanta, as opposed to a full-fledged lab. If it weren't for the fact that we were partnering with labs in France and other places, we wouldn't have gotten as far even just to identify it at the very beginning. And
right, it's so hard to remember back to the Ryan White days and all the discrimination, and that impeded so much of the research and the tracking. And Gary lived that. Gary literally went home to home to track, you know, and we've talked about it many times. But hey, listen, let's segue into the, you know, positive, where we're going in the future cannabis wise, Gary. And I know, listen, Bud's Place, and you'll talk about it. Consumption lounges are going to be coming into the cannabis space as we go towards legal adult use. And listen, we'll just take it that way. And I guess to the extent of how the pandemic has affected every venture that has people gathering together, I'm sure it's affected, you know, what's been going on that way. But tell us about consumption lounges and a little bit about Bud's Place and stuff like that.
Well, here's the situation. I mean, anybody could use alcohol at home, and yet there are tens of thousands of bars across the country. So, and why is that? Because people are social animals, as you know, and then everybody was complaining about how the social aspect was missing from all the lockdowns and things of that sort. Yeah, we are basically social animals, but being told the only place you could possibly use your medicine is when you are at home, and hopefully in a place either you own or the landlord allows you to do it. Other than that, where can you go? Where can you go to utilize your product? They were very specific in the law over here in Florida that you cannot use it in a public space of any kind. That means that transportation or any other place. You're stuck in your home. And so therefore, where can people go to have a safe space? And that is where consumption lounges come in, basically. It's a place where you can go where it is safe to go ahead and use your medicine. And there's no issues in regards to that is concerned. And you always have people looking out for you. So if in case that you are not capable of traveling home on your own, and that does happen when people do overdo it or because they're ill, things of that sort, then we can make sure that people get home safe as well. But Bud's Place is a place for smoking, but it's also a place for entertainment as well. And they have food available. We're not going to have alcoholic drinks because in most states they disallow, even those who allow cannabis lounges, they don't allow alcohol.
So what's the status around the country right now with consumption lounges, Gary? Are there some municipalities, states, out in California, out in Vegas, are there active consumption lounges at this point?
There's approximately 10 consumption lounges across the country right now, some of which have been there for years, like Barbary Coast over in San Francisco. That have been around for the last 20 years. But there's only 10 states in the country that actually have consumption lounges actually written into the law at all. In many cases, we will be able to put them in because of the fact that there's no law saying that it's actually against it per se. And like for instance, in the state of Florida, say you have to be in a privately owned place. Well, If it's a club of nature where you have to pay to get in, and there's a cover charge, things of that sort, that makes it a private space, and so therefore we can utilize that.
So what prevents somebody from, like, because I have friends who own several hookah lounges throughout the state of Florida. One, it's interesting you said about food consumption, because in the state of Florida, at least for the hookah lounges, you are not permitted to have, because people are inhaling and ingesting smoke of some kind, even if it's in through the hookah, you are not permitted to have food. And they're not allowed to have any food. And they have to have a very elaborate what you call it?
HVAC.
HVAC,
your
like
air
exhaust,
purification systems, of course, sure.
Special air handlers.
Even here in unregulated Florida.
Yeah, but they do. I mean, they have to have special ventilators put in there and things like that. And the reason why the food's not allowed is because technically in the state of Florida, all restaurants are not allowed to have smoking anymore inside their premises. So you cannot have food and smoke. And according to guidelines now, like I said, at least for the hookah lounges, they're not permitted to have food. So I'm surprised that they would allow food even in the consumption where there's going to be cannabis, because if somebody's, if you're going to flower and you're actually smoking, I'm going to be really shocked if they actually permit that in the state of Florida, just because I just don't see that.
Well, Gary, you would expect it to be fluid to a certain extent, right? That the rules are literally going to be written kind of as we go. I mean, let's kind of just back up a little bit and talk just about what you've done legislatively. And I want everybody to know that I really owe Gary a lot personally and professionally. When I came into the cannabis space, he was really one of my earlier contacts who really, and listen, we're both Sigma Alpha Mu fraternity brothers, Gary, Michigan State, myself, Ohio State, not Michigan, which is great. But because we both hate them. We listen, I don't know who hates Michigan more than, Michigan State or Ohio State, which is great. But the point is, Gary really wrapped his arms around me and taught me a lot. But what I know about Gary is that he's been writing bills. He's been at the head of this legislative, effort. And so, Gary, you would agree, right, that a lot of these things are going to be kind of written as we go, so to speak, both at the state level, county level, municipalities are going to have their say. I mean, it's not going to be an easy effort to get these open, here in Florida specifically, but it's important because, listen, if you go to Vegas right now, for example, and you're staying in a hotel and you go to their illegal adult use market. So you go to the dispensary, you buy products, and then where are you going to use them? You can't use them in your rental car because there's no smoking in a rental car and you're not going to drive, right? That makes sense, of course. Can't use them in your hotel room. You can't use them walking around on the streets. So, Gary, it's interesting. A lot of the consumption in Vegas these days, last time I was out there, is on the top deck of the parking decks.
I can see rooftop.
Rooftop of the parking decks.
You
park your rental car. And I'll tell you the best one, everybody, is the top deck of the Rio. The top deck of the Rio has got a fantastic vista of the entire strip. But, seriously, you'll find people congregating up there and it's almost accepted. There are some of the hotels out there now that are 420 friendly, but it's going to be interesting to see how that evolves, but what you're saying is true, especially when it comes to cannabis. Cannabis users like to be together. They like to join together. They like to talk. They talk politics. They talk social issues. They talk cannabis itself.
But
right?
The only thing, and I don't want to play devil's advocate.
No, that's why the show is here.
I understand that if it's a recreational state, but if you're in a medical state, you cannot justify medical necessity to be congregational. I don't see myself going and taking my Coumadin or my Losartan that I have to have it in a social environment. So I think to pass that off to legislators is going to be a tough sell as to why that would have to medicinally be appropriate. I just don't see
I agree.
that
There's a difference between the medicinal and the legal adult use state. But Gary, can you imagine getting a room of newbies, a room of doobie ones together on a Saturday morning and allowing them to try their products together for the first time in a social circle? Say 10 of them, and they all try their products. And listen, Ruta, I would go a little bit to the other side of saying that it may not be the social atmosphere that they're looking for, but they may want to share stories. They may want to share experiences. And
that's a 50-50 because you
I
see
know.
patients here when they're newbies, they don't even want to tell anybody they're on it. So
Well, that's true.
I don't see that happening.
I agree.
Yeah,
It's a great
they have
debate.
like the hat on. They don't want to be seen.
You know what? Those support groups are valid. And actually
They
pre-COVID, there was a call for the support groups, and there still are. But you know,
I'm
in the
sure there
social
are.
circumstance, it will be interesting to see, you know, each state, each municipality. But to me, it's an exciting concept because I think, listen, Florida's going to go legal adult use. Gary, what's your estimate on the timing? How do you see us going forward towards legal adult use, and what are the next steps as you see them coming down in Florida?
Well, first of all, I want to give a virtual slap of the hand to Ruta for using the word recreational, with all due respect, because when you hear police or any even politicians talk about recreational drugs, that usually includes opioids. It usually includes all sorts of things we would not even want to consider being in the same category, which is why we're trying to get it out of Schedule 1 right now. Heroin is considered a recreational drug, and therefore we need to try to get ourselves away from that. In fact, the use of the word recreational came in California when they were trying to avoid actually getting an adult use market in the first place. So they tagged it as recreational so that would be a negative. And in fact, it worked for many years. Unfortunately, for whatever reason, it seems to be spreading again, but we're trying to get rid of that word recreational. That would definitely help as far as the law is concerned. As far as when it's going to happen in Florida, I give it at least 3 years that we have to legislatively ourselves. They've made it nearly impossible to do it because of the way that they've changed the voting laws. Although those are being challenged right now, as in most of the big bills they did last session, including the protest bills. Everything is being challenged. But right now, it's very difficult to get any kind of a ballot initiative going. And right now, with the makeup of the House and Senate right now being highly conservative, it's
and the Supreme Court.
Exactly, especially the Supreme Court, who constantly evaluates everything that we've done. Home grow, we won in the lower courts, we lost in the higher courts. Same with everything else we tried to do in the courts this last couple of years, and Florida grown as well. That is what we had to deal with. But so I would say it's going to be a mixture. Federally, I don't think it's going to happen this year. They got too much pushing for the infrastructure and things of that sort. But and Biden is not all in. And in the bill that Schumer wrote has got some issues to it, in part because it may just hand the industry off to the mega manufacturers, the people who have hundreds of millions of dollars available to go ahead and make things like the tobacco companies, the cigarette companies like Altria, who's already working on that kind of situation. We want to try to avoid that, as well as passing things off to big pharma, because they tend to play with the prices, play with the quality, and things of that sort.
No, I'm disappointed in the federal stance right now, Gary, and President Biden. Absolutely. And you know, it's another segue into it, because what I'll say is that when they did the Farm Bill 3 years ago, or whenever they did it, okay, they had no anticipation of the fallout, okay, in the cannabis world from the Farm Bill, and the ability of people to now grow hemp and to grow CBD rich hemp, which created a CBD rich market, which demolished the prices of CBD, which led to the, coming to the fore of Delta 8, and now some others. And I don't want to go specific with others, but I do want to give a little plug to next week's Green Room. Dr. Gerdeman's going to be joining us because we really need to discuss some of these new cannabinoids that are coming down the block, and it's scary.
It's scary.
It's scary from the production side, because we really don't know what's left in the products. Delta 8 in and of itself is none of these are well researched. Let's face it. We haven't even then listen, Gary, here's my point. The feds will mess this up too. I'm afraid of the compromise that's going to lead to putting cannabis or THC, who knows how they're going to do it, in Schedule 2 or Schedule 3, and not get the complete descheduling and decriminalization that we need, right? So to me, I'm very hesitant to see how this is going to come down per the feds, because I have no confidence that they're going to do it right. I just don't. So we need to be in the forefront of education, of safety, and really making sure that educationally people understand what's going on right now.
Gary, do you see like the feds going like kind of like a loosey-goosey thing eventually and then kind of leaving it to the states, but like maybe making it acceptable, descheduling? And then do you think it would go state by state still, or do you think the feds are going to have a huge umbrella over it?
Well, the Cannabis Opportunity Act, which is the bill that was introduced and is still in public opinion right now, that Schumer and those folks put together, actually does allow the states to continue control the program within their own state. So it will allow Idaho to continue to stay as dry as they are right now, in South Dakota and Nebraska and Alaska and Kansas, who still don't have any kind of program, and possibly keep Texas to have their CBD only programs as such. What will be different will be interstate commerce.
Yeah.
And that is going to confuse the heck out of a lot of people, because of the fact that you will be able to take things across state lines. And yet if there's not reciprocity rules, then there's going to be issues. So it can get confusing, but that is the way they're laying it out right now. And they're just replacing one patchwork with another patchwork. And that, in my opinion, is not going to work. You've got to have some kind of standard that goes across all states, a minimum standards at least. But being is that,
like in the cannabis space that you see, like, because I know you're a huge activist, like, do you see like any kind of a unification among like the cannabis industry leaders to kind of come up and actually formulate something that they could actually present to the feds and say, like, look, this is, as an industry across all the states, this is what we want to see, and this is how we think it's the best rollout to do? Or is there anything like that kind of a coalition?
it's funny that a lot of the CEOs tend to coalesce, especially the heads of the multi-state organizations, or MSOs, who get together from time to time and try to work out rules. But a lot of them really don't want to play in the same sandbox as the rest of the organizations. I saw that with True Leaf at the very beginning, when we were trying to get some kind of standard of education that goes across all of what few dispensaries we had at that point in time. The answer basically was nobody wants to work with anybody else. Everybody wants to get the head up on somebody else, because we're in a competitive capitalist society. Everybody wants to be on top. And so therefore everybody wants to try to control the law as well as the commerce. And that is just not working. And it's going to be to the deficit of the entire industry if we don't get some kind of industry. But the fact is, the advocates like myself, the ones who are not in it for the giant money, believe me, I'm not into it for the giant money. I don't have any. But we're trying to get people together to get them all on the same page, but not necessarily the MSOs, because they're all competing against each other.
Yeah, it's frustrating. And, Gary, it's interesting. Of course, I tell everybody, we're 12 at least MMTCs behind in the awarding of licenses here in Florida. As you know, of course, 4 MMTCs with each 100,000 patients, right? And then there's the Pigford case and others, So I tell everybody, listen, we legitimately should probably have 26 to 30 MMTC organizations right now. And as vertical as that is, the more the competition and quality and availability. So listen, we can only take things as they come at us, And fortunately, we were able to vote on this back in 2016, because you're right, another constitutional amendment is literally impossible, here in the state of Florida at this point. So we have to take it step by step by step. We need job protections here. Listen, the issues that they are, and we have legislative session coming up. And I look forward to seeing you up in Tallahassee. I'm sure we'll see it before then too.
Absolutely. I'd like to see it have more competition, but right now the OMMU has no taste to move this program forward. And by saying they're going to give out the Pigford license first before they give any of the other ones out is a dead giveaway that they're not planning on moving forward, because that particular license is being challenged. It shouldn't even be there in the first place, to be honest with you. With all due respect to my friends who put it together in the first place, having one license for minorities in an entire state of 22 million people is not equity. It's tokenism.
Yeah, it's tokenism. It's insulting in and of itself. And, they say that they're writing the rules for these new whatever. I don't know, Gary. It's amazing that they have not awarded these. The patients deserve it. And we always, try to take it back there. We're always about patient access, patient availability of product.
Yeah, quality,
pricing, best quality, consistency, all of it.
There's
so
many things for them.
Come on, guys, get it together up there in Tallahassee. But listen, we're going to be up in October. We're coming up for committee weeks. The doctors, as you know, are organized, and we'll bump into you up there. but I may see you before then too. Are we 9 o'clock? Because I don't have my phone in front of me, Adam. All right, good. Gary, listen, thanks for joining us, and
Yes, thank you.
Happy New Year to you, and best to your lovely wife. And we will see you soon. Keep doing everything you do. And, I look forward to seeing you soon. Stay safe and healthy.
Listen out to us. Stay safe.
You got it.
Thank you, everybody. See you next week on the Green Room.
Go Bucks.